And after 9 months in space, the two astronauts will have more to adjust to than just catching up on emails. They'll have to begin readjusting to life with gravity. Down to their DNA, astronauts' bodies can change in weird and sometimes significant ways while high above Earth. They start to elongate, often developing a taller space height. And because human bodies are mostly liquid, redistribution of fluids may also give them chicken legs and a puffy head. Once they're back, that all starts to return to normal. Scientists are still figuring out the long-term health effects of spending a lot of time in space, but decades of data shows that astronauts undergo physical changes after even a brief period. Earlier, we spoke with Dr. Abhishek Raut, medical director at Appletree Medical Group, about some of the challenges astronauts face when up in space and how long it takes for everything to go back to normal.
When astronauts venture into space, their bodies will experience a range of physical changes, mostly due to the environment having microgravity, and also the increased exposure to cosmic factors. So one of the biggest, most significant changes we are going to see is muscle atrophy. So as muscles no longer need to work against gravity, we will see that the muscle fibers themselves will begin to weaken. And that's why astronauts in general have to spend several hours each day on exercise regimens to maintain their strength. Another big change we see is bone density loss. In space, bone loses minerals quite quickly, about 1 to 2% per month. And this is because they're not subjected to that typical gravitational stresses that will stimulate bone maintenance on Earth. And so in this case, what you are seeing is over time, you're going to find that these losses could be compared to even an early stage osteoporosis. And really, it requires a lot of careful planning, and maybe even medication updates and targeted exercise protocols to make sure that doesn't happen. The microgravity also causes a redistribution of body fluids. So without gravity pulling fluids downwards, the astronauts will have a fluid shift more towards the upper body and head. And this can lead to some facial puffiness, pressure in the ears, but more concerning, sometimes we start seeing vision problems as well. And the optic nerve will adapt to these different pressures as best as it can. We also see that the cardiovascular system is affected. The heart is now pumping in a weightless state. So as it gradually adapts to this lower workload, sometimes we see a diminished cardiac capacity, which is something that we do have to manage carefully during spaceflight.
We also asked Dr. Raut about how these changes to the body depend on the length of time they're in space and how long it can take to fully recover once returning to Earth.
Right, so that is a big concern here because when astronauts spend longer periods of time in space, many of these physical changes we observe can become much more pronounced, and then they can edge towards being a little bit more permanent as well. So to talk a little bit about the muscle atrophy and bone density, because in microgravity, the muscles don't receive that same resistance as on Earth, this progressive muscle atrophy over time can be very pronounced. We have studies from the International Space Station, which we see more longer missions anyway, showing that astronauts can sometimes lose up to 20% of their muscle strength and about 2% of their bone mineral density strength per month. To give you an example of how rapid that is, for an average male at age 30, you would lose about 3 to 5% of your muscle mass per decade. So what we see here is we do need very strong targeted regimens like strength training at spaceflight, but also when they come back to make sure that this is not permanent. We also, when we talk about these fluid changes, there are things that we do worry about. There's a specific condition called spaceflight associated neuroocular syndrome, which is when that fluid shifts and kind of pushes towards the eyes more, and then over time can actually cause a vision impairment. And sometimes that can, in fact, be permanent as well. When we look at the cardiovascular adjustments, we do know that the system is a bit more flexible, but it does remodel over time in space. And then when we come back to Earth, sometimes the heart and the cardiovascular system is just not used to that increased capacity. And certainly that takes a long time to adjust as well. So what we do find is sometimes when we return back to Earth, it depends on how long you've been away. But if you've been away for a significant amount of time, sometimes it also takes years to readapt. And some of these conditions may end up being permanent as well.
One question that has been asked amid Miss Williams and Mr. Wilmore's extended stay at the ISS is how space travel impacts men and women differently. So we also touched on this subject with Dr. Raut.
When we look at the effects of microgravity on the human body, what we'll see is there's going to be a lot of similarities because both male and female astronauts will face very similar challenges there. But we do know that there are subtle differences in what we see. For example, with the cardiovascular responses to microgravity, we do see some gender-specific nuances. We do have research that shows that women might be somewhat more prone to this orthostatic intolerance. So a condition where the body struggles to adapt to the blood pressure once you're standing back on Earth as well. Bone density loss is another area where we do see some differences that emerge over time. Now, both sexes will lose bone density at a rate of around 1 to 2% per month in space, but hormonal factors like estrogen can play a very important role and a protective role in bone health under normal situations. So we do find that there's a protective nature there. And then finally, what we are seeing, and this is relatively new as well, is there are subtle differences in the immune system and cellular responses as well. So we are seeing gene expression patterns or cellular signaling that may be a bit different between men and women in the face of prolonged space travel. Now, this is very early on in the stages there, but the initial findings show that there may be differences in recovering when you come back to Earth between men and women, and there may be conditions that are more inflammatory that affect one gender more than the other. We still don't have all the information, but certainly something that we are keeping in mind.